Hi guys, it's me again, Dr. Seb. Thank you for watching my channel, Tanya Je Dr. Seb. Today I'm going to share with you about sepsis. What is sepsis? Let me share with you the story of Madam L. Stay tuned. Madam L is a single old lady. She stayed alone at one of the apartments. One day, her neighbors noted that she's less responsive at home and she was sent to hospital via ambulance. Doctors found out that she had a flu 1 month ago and her appetite is getting worse. She had fever, shortness of breath, and unable to walk. The condition deteriorated over the last 1 month. When he reached the hospital, she already in comatose. Doctor put her on breathing machines and she was admitted to ICU. Doctors also found that her hand, her leg, and the toes and the fingers all discolored. After 2 months of intensive treatments and management by doctor, she survived this disease. However, she suffered necrosis over her toe and her fingers. What an unfortunate lady. What she's having now is sepsis. What is sepsis? Sepsis is a potential life-threatening condition that our body responds toward an infections. The infections can come from bacteria, viral, fungus, and some prions. Prion is a protein. Usually, during infections, our body will release some chemicals to counter and kill the pathogen that invade our body. However, when the pathogen is so strong, our body needs to counteract with more chemicals, and this triggered a severe inflammation. This inflammation can kill the pathogen and also destroy our body as well. This chemical can directly injure our body organs such as like heart, lung, kidney, or the muscles, and also blood vessels. And when this organ fail, it can cause our blood pressure low and lead to septic shock. Septic shock can cause a person lose his life. So, who is at risk of getting sepsis? Those adults who are more than 65 years old, those who have weakened immune system, those children who are less than 1 year old, those who have chronic medical illnesses such as like diabetic, lung disease or kidney disease, those who are on steroid or chemotherapy, and last but not least, those sepsis survivor. Repeated sepsis can cause a person's immunity worsening and got sepsis more easier. What is the sign and symptom of sepsis? It is the same with the word sepsis. The first S stands for shivering. E stands for extreme pain or discomfort. The P stands for pale or skin discolorations. And the other S stands for sleepy, means patient is difficult to arouse or comatose. The I stands for I feel like I might die. And last but not least, the last S stands for shortness of breath. What shall we do when we suspect ourselves have sepsis? First, we have to understand that sepsis is a medical emergency. All sepsis patients should be admitted to hospital. If we are not sure that we are having sepsis, you can always call 999 and get a teleconsultation. The doctors or the paramedics will tell you whether you are having sepsis and you need to come to hospital or not. So what happens when a sepsis patient admitted to hospital? First of all, doctors will run some blood tests to see how bad your inflammation is. Also, they will try to trace the infection source. They will start injectable antibiotic immediately. They also will start drip to rehydrate the patients. They will give some steroid to boost the patient if the blood pressure is low. If the oxygen of the patient is low and patient is shortness of breath, patient will put on oxygen. But if the shortness of breath getting worse, patient will subject to ventilations, which is the patient will put on a machine. So, sepsis is a preventable disease if early detection happens. To recognize sepsis is not easy, but follow simple training, we can identify sepsis immediately. Early detection saves life. Let us hand in hand make Malaysia free from sepsis.
Malaysia free from sepsis.
Please share the video to benefit others as well. And please leave some comment under the video and give the video a like. Please do not forget to subscribe my channel, Tanya Je Dr. Seb. Thank you.